Debunked, where we discuss healthcare news without fear or favor, or most importantly, without fluff. I am Arundhati Parmar, Editor-in-Chief of MedCity News.
And I'm Samir Batra, the Managing Partner for HIP. We're an early-stage venture firm.
So Samir, we've had a few weeks to digest the latest election news. I will be the first to admit that I abhor most of what Donald Trump has stood for or has said in the past. However, I was no fan of Kamala Harris, although I did donate to her campaign because I wasn't ready or didn't want to accept the alternative. However, now, you know, democracy has spoken, and I like democracy a little bit more than I dislike the president-elect. So Mr. Trump is my president now, and I wish him luck. I think I have one thing to say to little girls out there, women out there, and fathers of little girls out there who feel terrified of the future and feel like they don't recognize the country that they're living in. I think elections have consequences. We may have looked at 2016 and thought that was a fluke. 2024 is certainly not. And demonizing the other side as misogynistic, as racist, is not a winning coalition building strategy. Yes, enough people did not come out and vote, and if they did, who knows where the election would have gone. But these are the results as they stand. We need to understand other side.
Yeah, look, the people have spoken.
Absolutely.
Right?
Absolutely.
I mean, you can't deny that. So, look, what does an election typically come down to? It's issues, and then it's the candidates, right? So you have
and their personalities, right?
Well, and I mean candidates. That's what I mean, like personality, their stance, marketing, whatever you want to call it.
Sure.
But it also comes down to, so you have issues and candidates, but it comes down to the candidate's ability, right, to impact those issues or communicate their strategy against it, right? So look, no one's going to deny this. Like him or not, Trump is a better marketer. He just is, right? He has the ability to communicate to all of America. I'm just going to say that, right? And so that was the difference. And the other thing is, you know, last time around, you could sit there and say, well, Clinton, Chelsea, Democrats, they underestimated, you know, Trump in the first election. There was no underestimating this time. This was a clear-cut, like, smack, I won. So, I mean, that's, and it really speaks to certain issues like you brought up. There's a divide of, you know, the way people look at things in this country. And then it really became time to, let's just be honest, the divide is maybe 50-50, but then who did a better job of communicating what he's going to do around that divide or fuel that divide or whatever stance you want to take.
Yes.
It was basically a question of a better marketer. I honestly believe that. And Trump is a better marketer.
I mean, Trump is a better marketer. I would also like to say that maybe they did a very good job of managing, you know, people's anxieties and working and targeting that, because from an economic perspective, people were hurting and they were not buying the message that Bidenomics is great. I understand that. So in my humble opinion, I think the real challenge in this election was who can communicate about pocketbook issues, as opposed to really lofty things like democracy and women's rights and transgender rights. I think those things became more peripheral. But I think I'd like to say the biggest change for me was how I took the news. In 2016, I was more dejected, I was more down. You know, my brother at the time was living and he had a host of health issues, and so I was doubly down. And this time I'm more resigned. I'm more resigned to the chaos. I think that is inevitable. However, you know, my husband is more positive. He thinks that maybe something can be achieved from a, you know, the government inefficiency perspective, what Musk and Vivek Ramaswamy can do. And I'm hopeful. I mean, to me, I've always found Musk to be absolutely brilliant. He has tested the limits of free speech. But I think the real question for me is that he may have really good ideas, but can two humongous banyan trees exist in the same forest?
Look, it's just a matter of time before they clash. I mean, it's like it or not, two egomaniacs, right, existing in the same space, working well. We've never seen that before. But then, you know what? I'll also say, we also never thought that Trump would become president, and he became twice. So, like, maybe it'll happen, but it's just really hard to see coexisting happening. But anyways, you know what? We're a healthcare show, right?
Yeah.
So let's talk about healthcare. Like,
Yep.
where do you sort of sit with this? And let's talk about good old Bobby boy, right?
Well, I mean, it's a little bit like the insane running the asylum. You know, I just for kicks, I did a search on ChatGPT, talking about the search. The prompt was this: what are the different crazy conspiracy theories that Bobby Kennedy has talked about when it comes to healthcare? The answer was 8. Now, some we know, like fluoridated water is bad. That's what he feels. He talks about how vaccines cause autism. The COVID-19 vaccines are unsafe, things like that. But I think there were a couple that I didn't know that are really out there, like 5G and how 5G is bad for the 5G technology, mobile technology, is bad for you because it can cause cancer, infertility, and neurological problems. Right. He has said stuff about Bill Gates trying to, depopulate Africa through vaccines. So those are the things that are, I think, a little scary. However, I will agree with him on one important thing, and that is, the harmful effects of processed foods that pass as food or pass for food in America. I think if he's able to, despite the craziness, again, I don't know if he will be nominated, he will be approved by the Senate, but if he can tone down the anti-science stance and really does go after the processed food industry and the food industry as a whole, I think there will be some support. But I'm trying not to bang my head against the wall with some of the nominations.
So Bobby boy, there's one thing you're going to have to give him, okay? It's full transparency.
True.
Right? And the one thing that I do like that he says is let's limit corporate influence on health policy. Awesome. Okay? That includes pharma.
Right.
He's not a pharma fan. Okay? But personally, he has said some batshit crazy things.
Right.
Right? I mean, completely out there. Like, I want to pick on this one because it's just so much fun. Let's pick on the COVID vaccine piece, okay? First of all, bro, what background do you have on healthcare?
He's an environmental specialist, right?
I understand. And so the impact on environment, on healthcare, great. But this is HHS.
True.
You don't have a healthcare background, okay? You have a policy background, you have views, you're a lawyer, blah, 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 all that sort of stuff. Okay, so let's take COVID vaccine. He doesn't like the COVID vaccines. Great, okay. So let me ask you, Bobby, what was your plan? How are we going to deal with the vaccine? Right? How are we going to deal with the pandemic? Look, Imperial College of London did a study that said if we didn't have a vaccine, in 2021 alone, there could have been 20 million more deaths.
I know.
So Bobby, great, you're anti-vaccine. What's your proposition, right? What's your plan? And I think that's where I sort of stand on these crazy, wild, claims that he makes. And that's what's scary, because now you have somebody who's going to be leading health policy for the entire country when it comes to aspects like this.
Right.
So, yeah, I mean, just like a lot of appointees that Trump is having, you just go like this, I don't know how this is going to play out.
Yeah. Well, we can't just stop with Robert Kennedy Jr. We need to talk about Mehmet Oz, who's going to apparently lead Medicare and Medicaid. Can you say quack?
My favorite Turkish doctor. No, I'm kidding. I don't know. I don't know any other Turkish doctors.
Nothing against Turkey, again, Samir.
No. I love Turkish restaurants. I love Turkish food. I love Turkish people.
Okay.
No, but let's wait. Let's just stop for a second, okay? TV personality turned public servant. Have we seen this somewhere before? Oh, wait, yes, we have. We're examining it right now, right?
Yeah.
So he is a doctor, okay? And Oprah blessed him, said, I bless you. Go get on TV and tell people about health and wellness and stuff. He had a good thing. I mean, I remember we were in New York, we were in Jersey. Actually, fun fact, he lived in my building.
Oh, interesting.
Okay? So you had a good thing. You had people. You're an engaging personality. And then you just lost your shit. Like, he just took it, unprofound claims. I mean, Colombia wanted to remove him. Like, like all these things happen. And the master flip-flopper when it comes to politics, right? You're going to put this guy in charge of CMS now? Now, one thing he does talk about clearly, innovation. Okay, look, as an investor, I'm like, yeah, that's awesome. Like, if you're going to make, regulations, procedures, reimbursement, regulatory, all that sort of stuff, pro-innovation, that's awesome. But then the crazy notion on top of it, where he has like wild claims, what type of innovation are we talking about here, bro?
Yeah.
That's the scary part about it, right? So again, we'll see if they make it through. The making it through the nomination is the first hurdle.
Yes.
If you look at the last Trump presidency, a lot of his people don't last the 4 years. So you might need to be just prepared for multiple candidates. Right?
Yeah, I mean, that is, I think the first thing is whether they will be, they will go through the Senate process. I know there was some early talk of recess appointments where Senate would not have to, not have to actually vote, but I don't know whether senators want to be like doormats, so they probably won't go for it.
Yeah.
We'll see. I'm not a believer in God. However, if I were, I would say that I'm praying fervently that these people realize that the American people and the president have given them their faith. I hope they understand the weight of their offices and the fact that the American people are depending on them for their safety, security, and well-being. All right, enough with the POTUS-related healthcare stories. We could go on and ever. I wanted to switch to proper healthcare news, unrelated to our 47th president.
Okay.
So what happened in mid-November or so was J&J actually sued the federal government as it relates to that 340B drug discount program, which, as you know, is a program by which hospitals get hugely discounted prescription medication for taking care of underinsured or financially disadvantaged patients. J&J said that they were going to change that program quite a bit, such that they don't provide the discounts up front, but if the covered entity, the provider or whoever, provides them the claims data, this happened in August. They said that if you provide us the claims data, we will give you these discounts, but as rebates after you've purchased it full price up front.
Yeah.
Now, the Health Resources and Services Administration, which is the entity that administers the 340B drug discount program, they basically said, hold up here. This is inconsistent with the statute. That's what they said. Well, J&J sued him, but their entire argument is very, very interesting because, we've seen this movie before in a way. Like, when it comes to high drug prices, who are the villains? The pharma and now the PBMs. These are the historical villains. And J&J, through their complaint, is saying, no one's hand is clean here. What they basically argued, and I'm going to just read off of the complaint, they said that their program has been overtaken by for-profit entities who have exploited the program for profit. So, quote, put simply, what was intended as a buy low, sell low program for vulnerable patients has turned into a buy low, sell high commercial business opportunity disconnected from its public health mission. This is the opposite of how charity care should be funded. The 340B program creates incentives to provide services to insured patients rather than those vulnerable populations most in need of affordable care. So they're basically saying, hey, providers and hospitals, you are double dipping. And I'm really curious about this, Samir. I'm curious to see how this plays out, how much evidence they have, if any, against some of these providers, because if they're successful, many other pharmaceutical companies are going to follow suit. Already, Eli Lilly has joined them.
Yeah, I mean, look, it is he said, she said, right, at the forefront. Okay, they took a stance and said, well, we're going to just follow the rule, but we're going to just twist it in terms of like our business favor. Look, on the surface, they're a company, right? They have a responsibility to their shareholders. They're trying to do the right thing and say, look, you know what, we need to protect the fact that we feel like we're being taken business advantage of. Right?
Yes.
So I guess, and this lawsuit is going to play out. I mean, who knows what, you could literally have arguments on both sides here that sort of have validity, right? From a business perspective, J&J is protecting their business rights, but obviously by completely rejecting the program, you're basically sitting there going, yeah, we don't care if, like, you know, underinsured or poor people die. Like, that's a really hard stand to take as well, right? You're going to just stop, I'm not going to do it. So I think it's really interesting if they're sitting here saying, hey, you know what, providers, show us claims data and then we'll reimburse you, basically.
Yeah.
Well, you know, you're saying that for-profits are taking advantage of your program. Well, where's your data? Right? So, like, I think in the court, this is what's going to sort of come out, is going to be like, well, you're claiming this, that's wonderful, show us data that you said that this is happening. And I think the thing is that with these providers, and a lot of the nonprofit providers that are sort of taking advantage of this, or you have like trauma centers or like, you know, real like inner city, you know, hospitals that are sort of taking advantage of this program for their population, they don't have the means to stand up this practice in a timely fashion. Hey, hold up, I can't give you that drug, it's too expensive, let me go, or let me give it to you and then I'll figure out how to get reimbursed for it. Like, that data, like, it highlights a bigger issue.
Yes.
Right? Like, not just like about, oh, low prices on drugs and then I'm going to turn around and get reimbursed. How am I even I don't even have the manpower to treat people. You want me to have manpower to like comb through data and then feed it back to you so that I can get that reimbursement? I mean, it unlocks a bigger issue than that.
I mean, I hear you. My mother always jokes that I'm a very black and white kind of person. I don't see gray. So to me, if the for-profit entities are double dipping, then that should be stopped.
Right.
But remember that J&J and others have argued in the past that the 340B program has grown tremendously too.
Right.
So maybe this is a good, nice way to audit like who really deserves it and who doesn't. Typically, I can't believe I never really, stand on the side of larger corporations, but to me the truth matters. So if J&J actually provides evidence that lists, hospitals and providers and whoever other covered entities are taking advantage of this wrongly, then I'm all for it to be curtailed.
No, 100%. That's what I was saying. Like in the court case, I mean, you're going to listen to both sides, right? So both sides have to provide evidence.
Yes.
So then if they're sitting there claiming that the for-profits are doing this, great, where's the data? You know, it sounds really easy to do. It's going to be really hard to go and get that data.
Really?
I mean,
they know who's applying.
So
Why
they know
is it
who's
hard?
applying, so fine, you're for profit. But to prove that you took that lower discount and the cost savings were then applied to certain other projects, like how are you going to tie those knots? Anyways, I'm just sort of being a skeptic
I
there,
mean, if the provider gets the discounted drug up front without showing who they're using it for, they could maybe give it to patients that can well afford it, have insurance, and then get paid back by that patient's insurance company, right? That's what I'm assuming.
No, I know, but it's also cost savings too, right?
Yes.
So then you're like, oh, it's cost savings, cost deference, and then those cost savings that you had, what did you do with those dollars? And it's like, a hospital could argue, well, it's spread into like our operations across 40 different things we're doing. So now how am I supposed to stitch that back together? Again, I'm just sort of sitting there going, challenging this. Get your popcorn ready, because these court proceedings, I hope they're on court TV, because this is going to be fun. It totally is.
There is no court TV.
Damn it.
But I do think this is really important, because I've heard from payers that, doctors tack on slight markups on drugs.
Right.
So yours will be probably one of the first times that we see actually, hoping that J&J is transparent and they don't settle somehow. Maybe they will settle, I don't know. But maybe we get to see how the sausage is made.
Yeah, no, I think, look, price transparency has been something that I think almost bipartisan levels.
Absolutely, I think Trump did a lot on that too.
We need that, right?
Yeah.
From everything from services to drug prices to everything. Transparency is never a bad thing, right?
Yes.
It should be part of good business practice. So let's see.
And hospitals and pharma, they have to put their money where their mouth is. Exactly. I think literally. So, all right. The final thing I wanted to talk about was this little tidbit of information I got from a different website, not from a MedCity news story, about how these health systems in upstate New York are reacting to closures of pharmacies in their neighborhoods. So what has happened is, of course, we reported on it. This part we have reported on, that Walgreens and CVS and Rite Aid and Walmart have been closing pharmacies around the country. They thought they could go big into primary care,
Right.
and now they realize that, God, we can't. Our ambitions were probably a little. We were probably a little too ambitious,
Sure.
and we probably don't have the exact wherewithal to be a primary care provider. Meanwhile, what these health systems, so it's a Jordan Medical Center, I believe, if I had their name correctly. UR Medicine, which used to be known as University of Rochester Medical Center, and the Rochester Regional Health System. These three entities are basically saying that we're either going to open new pharmacies in neighborhoods where the traditional pharmacy players have closed, or they're saying we have other campus locations that can help those that are displaced from those areas. Okay, so your local pharmacy closed, where would you go? Okay, come to our campus and get you pick up your drugs there. So I thought it was really interesting because the retailers failed to go into primary care, and now health systems, presumably people that are involved in primary care, are now going to be providing pharmacy services. I'm going to date myself here, but I feel like we have to cue Alanis Morissette's Ironic.
I mean, what else is there more to say on this, right? It's like retail pharmacies bombed in primary care, right? And that impact was not just felt by their primary care, their business. I mean, especially with an organization like Walgreens, it impacted their pharmacy side too. And same thing with CVS. So the providers are basically stepping up and saying, hey, well, we're going to try to fill that gap, right? And so now they're sort of playing in that role and saying, well, let us go into what you're kind of doing and kind of do it. This story's played out. We've talked about it, the Cleveland Clinic thing, the One Medical thing.
Yes.
The model, guys, is at the end of the day, do it together, partner together. But, I also feel like there's some just fat in the whole pharmacy chain brick and mortar existence. I'll give you a personal sort of anecdote, right? We live in this area, and pre-COVID, I kid you not, this is so true. Within a 2-3 mile radius, I have 4 CVSs, okay? And now there's 2. So they shut down, right? And so part of their process was also the minute clinic thing. We don't know, how many we need, all that sort of stuff. But I think it was they had built out too much.
Overreach.
There was a little bit more fat. So I think that's part of it as well.
Yeah.
I think the growth of online pharmacy and delivery has also impacted these guys. It's just like what Amazon did to traditional brick and mortar. I think pharmacy is sort of going through that effect,
right,
with one huge mistake that they made, which was primary care.
Right.
So I think it's we go back to being, again, you talked about the past, when we were kids and, your parent put you in the sandbox, you're supposed to learn how to play nice with others, not steal other people's lunches. Well, you got caught stealing somebody's lunch. Right?
Well, I don't know that the people who invented Uber would agree with that. They believe in disruption, but sometimes I feel in healthcare disruption is a negative term.
Yeah, but you know what? I'll tell you, even people at Uber are probably really happy that Lyft came along, because sometimes what happens when you have competition like that, or people in your sandbox, it helps prove your thesis.
True.
Right?
True.
Even as an investor, we look at competitive landscape. Why? Not just to sit there and say, hey, who's going to try to steal your lunch, but who's also selling your category?
Yes.
Right? It's sort of proving out your TAM, your SOM, and your SAM. So I think this is one of those situations. It's similar. It's well, now, you messed up, and now somebody's going to come and, hang out with you right next to you.
Right.
So.
Well, Samir, this is our last episode of the year. We began in February, so it's been 11 months.
We were inside, we went outside, we're back inside.
We're back inside. Well, the outside is so scary now.
Yeah.
Well, I'm saying this and I'm in California. So we've had 11 months of recording Debunked. We've had a blast. We really hope that you enjoy the holiday season. So happy holidays, Merry Christmas, Happy Hanukkah, happy family time for people who like me don't really care about any of these holidays. Really from a religious perspective, let me add. So enjoy time with your family, and it was great to be on for that many months, and we hope you join us next year in 2025.
Yeah, look, happy holidays, and it's going to be an entertaining 2025. I'm going to say that, okay? 2016 was a dress rehearsal. right? This term is going to be the real McCoy. But here's the one other thing I'll say: sequels are not usually as good as the original.
Oh my goodness.
I'm going to leave it at that.
Thank you again, Arundhati Parmar, editor of MedCity News.
And Samir, thank you again, guys.